So we're going to kick it off today, Wednesday, May 13th, and we're going to address the story that for the last 24 or so hours we've been working on, which is what will Governor Hogan announce at 5 o'clock? We know that there's widespread interest in what Montgomery County will do based on whatever decision the governor decides to announce at 5 o'clock. And so we're going to start off this briefing with County Executive Marc Elrich addressing that. We'll then move over to Dr. Gayles, who will make a couple of comments about that, as well as address another medical issue, and then we will open it up for questions. So without further ado, let's begin with County Executive Elrich.
So welcome everybody to this briefing. I'll talk a little bit about where we were. I was on a phone call yesterday with major county executives and the governor, and while he didn't reveal anything about what you're going to hear later this afternoon, they were still in the process of discussing it. What he did emphasize for us was that he was leaving it to local jurisdictions to make decisions about how far to open, and that we wouldn't need to ask for a waiver, we wouldn't need his permission, nobody would have to declare they were defying the governor, that we will make the best decisions for our jurisdictions. And he understands that. He acknowledged that the situation in some parts of the state is dramatically different than it is in our more urban counties, and that we need to do the right thing based on what we know about the science and the conditions that are local. So we were on with Montgomery County, Prince George's County, Frederick, Howard, Anne Arundel, Baltimore County, and Baltimore City, and we were all pretty much asking for the same thing. We all feel that we're more vulnerable, and we've got caseloads that are still growing, and that we haven't seen, the trend lines that were put out originally by the CDC, now nowhere to be found, except by people who captured screenshots of that in the old days, and also by the governor himself when this process started. And so we're still trying to adhere to those guidelines and make sure when we open that we're reasonably safe. I have emphasized this over and over again. There is no value in opening prematurely if it plunges us right back into this crisis again. And I think what we've got to keep emphasizing for people is that you don't know who's infected. And so to just open up the way we were before until we have much better knowledge about the spread of the COVID virus, and we've been able to identify more of the people who have it, would be putting everybody at risk. And I think the jurisdictions, collectively, myself, Angela, Muriel, and the others, that we all recognize that we depend on each other. Our borders are way too fluid. There's so much traffic and activity that goes back and forth that if one jurisdiction were to do something before other jurisdictions did it, we run the risk of creating what you would call in another circumstance an attractive nuisance. And we don't need everybody going to the first mall that opens or the county that has the first restaurants that are open, because we run the risk then of either bringing cases into that county or bringing cases home from that county. So we need to work together. We need a coordinated plan. I think, we've been talking about this for a while, and we're going to keep working together. And my hope is that we can all come together and that our caseloads begin to decline at the same pace across the region, and we'll be in a better place to open up. So we'll see what the governor has to say, but I think the good news is that we're going to be able to continue to make our decisions based on science, and the governor actually expects us to do that. So we are not going to be in a conflictual situation with the governor. That's the most important thing, I think, for all of us, and I think he's going to send that message. We are at almost 400 deaths now. That's almost a 100-person increase since last week. Deaths may go down slower than cases, or at least the percentage of deaths, because if you're sick and in the hospital, that doesn't change. That's not the same metric as how many people in the community have cases. And so we're looking for a reduction in cases. I see that DC extended their stay-at-home order till June 8th today. that is probably a very sensible decision. And, the governor has decided to keep Northern Virginia closed until May 29th. And we'll see. I hope everybody keeps revisiting these decisions as we look at caseloads and start approaching these dates. That's the important thing. You can't set a date and have the date be the most important thing. The most important thing is what happens to the caseloads. And if the caseloads indicate that that date is the right date, you should do what you were going to do. And if that date's the wrong date, you need to modify your date. Health needs to rule this decision. We're going to continue to emphasize the importance of physical distancing between people, wearing face coverings, and sheltering in place. And we know that our sheltering in place order has exceptions. So you can go to the grocery store, the hardware stores, people go to Best Buy. And so this is, it's obviously a modified form of a sheltering in place. What else? We are busy scaling up our test capabilities, because that's one of the critical things that we know we need, is to be able to test more people. We have signed contracts with people who can provide us more testing. We are not buying test kits. We tried to go down that path before and discovered the same thing the governor did. I could have bought kits, and I could have bought kits that were either incomplete or that didn't have machines locally that had the throughput to actually process the kits. So we're contracting with some local companies in our bio sector here in the county that have capacity both to provide us testing instruments and the capacity to actually run those tests and provide us rapid results, which is something that's important to all of us. We will be able to, I hope, offer mobile testing sooner than later. We've talked about bringing our testing out to the grocery stores and the Home Depots of the world, because we want to be able to test frontline workers there, as well as our own frontline workers, all the police and fire folks who are out there, the people who are doing home visits for child protective services, or serving the public in other ways that we've kept open. We've tried as best we can to keep services as normal as you can do in an abnormal time. So we've tried to maintain as much open as we possibly could do this, and we're going to continue to do that. We are continuing to work with nursing homes, and Dr. Gayles can talk more about that. And we're glad that the governor is setting up strict guidelines. This nursing homes are regulated by the state, and we're glad that the governor is paying a lot of attention to the nursing homes right now. We are also increasing our contact tracing ability. We've got a partnership with GW and the University of Maryland. We're working and hiring, we're working with another group to help us with contact tracing. And I think I'll stop there. That should give you an overview of where we are.
Thank you, sir. Dr. Gayles.
Good afternoon, everyone, and happy Wednesday. Good to see you all again, and thank you for continuing to cover and provide good information to our residents. To add to what County Executive Elrich mentioned, just to hit on a couple of things, we are looking at many of the same metrics that other jurisdictions within the National Capital Region are looking at to determine our readiness and ability to open back up. Just some of the measures that we're looking at on a jurisdictional basis include our number of cases, our overall number of cases, looking at a sustained decrease in that number in the setting of increased testing. And so as a result of increased testing, which I'll talk about in a second, we're also looking at our test positivity rate, which means, again, that the number of folks that we're catching over time continues to decrease as we scale up and test more people and test people more frequently. We are attempting to create a baseline measure in terms of the number of folks we test and how regularly we test them. For example, one of the early baselines for the state was approximately 2%. As of this morning, we have tested close to 3% of our population in Montgomery County. Our goal is to potentially be able to test 5% of the population on a monthly basis. We're also looking at hospital-related measures, including the number of folks in the hospital with COVID-related illness, the number of folks with COVID-related illness who are utilizing healthcare facilities, including primary care offices, as well as our emergency rooms. And we're looking at the percentage of hospital critical care units being used to take care of those patients. So again, these are measures that we're looking to see a sustained decrease in, to demonstrate that we are clearing those hurdles and are safer to open up. Now, a big component of that is the ability to test folks. And as County Executive Elrich has mentioned, we've talked about it before, we are close. We're finalizing details, but we are going to launch an aggressive effort that would allow for us to use some less invasive techniques to be able to screen and test our essential employees, because those are the folks who we've asked to come out in the last 2 months to continue to work and provide services and keep things moving. But also could potentially be those who are more likely to have been exposed in their time out in public. So we're continuing to work on that, and we'll be releasing those details shortly. And another piece that's important to our recovery plan is the concept of equity. And we want to make sure that all of the different measures we're looking at are being experienced by all segments of our population, and all of the efforts that we plan in terms of our recovery pieces are looked at through a lens of equity, however you slice that, to make sure that all of the provisions that we put into place are equally accessible and address the concerns of the broad diversity of our community. The last thing I want to highlight before taking questions is recently some of you may have become aware of case reports of pediatric illness related to COVID-19. Now, as a pediatrician and from a pathophysiology standpoint, I find this fascinating, is over the course of the COVID-19 illness projections, kids have been kind of off the radar. Most of them, the majority have had very mild symptoms. We've not seen, and in fact, in Montgomery County, knock on wood, none of our deaths have been anyone under the age of 18. But what we are seeing are case reports popping up of children experiencing inflammatory type illness secondary to COVID infection. And that illness mimics another condition called Kawasaki's disease. I've had the opportunity to treat Kawasaki's disease in concert with infectious disease specialists, and it can present in atypical fashion. And so there are case reports. I know that Children's National Hospital is taking care of a number of children who've exhibited these symptoms. I wanted to, because that's been in the news recently, I wanted to let folks know that as best as we know, none of our pediatric cases of COVID-19 have experienced those types of symptoms, but it's something that we will continue to look into and provide more information so that folks are aware and have an understanding of what's happening. I'll stop there and happy to answer any questions with the county executive.
All right, Dr. Gayles, thank you very much. And we're going to start with Chris Gordon with Channel 4, who has a question for both the county executive and for Dr. Gayles. Go ahead, Chris.
Yes, hi. It came to our attention that Prince George's County has the most cases in Maryland, but that Montgomery County has the most deaths. Is that correct? And attribute that, if it is.
So yes, based upon the surveillance information, that is correct. I would venture to say in terms of what may be causing it, unfortunately, a significant number of our deaths are related to nursing home fatalities, which means that, our fatalities are skewed towards the older population, whom we have deemed to be highly vulnerable based upon their age, as well as the significant number of underlying medical conditions that a lot of those individuals have had or, when they were living. So I would say that is what has been the biggest driver, unfortunately, for our fatality numbers. When you take those numbers out, it's not quite as high. And that underscores, as the county executive mentioned, the efforts that we have taken to address the cases in our nursing homes. Again, not to go back down memory lane, our implementation of action teams early on, working closely with the state. Even in the last week, we have done a number of physical site visits to facilities that may have hypothetically been in the news, some of you that you have reported, and we're working very closely with the state on deploying the state action teams that include the National Guard as part of that. And as to the county executive's comments again about testing capacity, part of our early efforts in rolling out those large-scale, high-throughput testing mechanisms will include working with our nursing home facilities and assisted living facilities to make sure that we can get residents and staff tested. We have worked with our ready responders who are part of the state team that has been partnering with us in our outreach in the shelter community and in our high volume zip codes. They have begun to help with that process. I know over the weekend they did a thorough testing of one facility, and the state will continue to deploy them to different sites. And additionally, I know that today, actually, the state action team, the new special operations team, is on site at least in 2 of the facilities across our county, providing tests as well as providing additional support in terms of infection control and reviewing the processes that the facilities have in place.
And Chris, did you have a question for the county executive as well, or are you all set?
I thank you. I think that was direct and sufficient, and thank you.
Okay, and Alberto with Telemundo 44 is up next for a question for both of our speakers.
Hi, thank you. So first of all, I wanted to ask about the hotline. I don't know if details are available about how it's going to work and when that's going to be available for the public in Montgomery County residents. I also had another question. Are there any considerations in the county, and maybe this is something that is already happening, of creating, of using hotels in order to isolate specific members of a family? As we know, that's a big problem in the Hispanic community. They live in shared households, multi-generational. So are there any considerations of using hotels or any other facilities to separate families, if you will? Thank you.
Sure, I'll start with the first question, the component in terms of the hotline. So that's an excellent question. The hotline is going live, hopefully no later than tomorrow. The concept of the hotline is that individuals can call our disease control number, the command center, and indicate that they are looking to have a conversation about being triaged and screened. They will their information will be taken. A provider, we've made provisions that providers can support this remotely. So a provider will then receive their information and provide a call back at a designated time. The provider will then ask them a series of questions, screen them, talk to them about their symptoms, determine if they meet the criteria, so to speak, to receive a test, and then we'll order a test in the CRISP system that provides the individual with a referral to any of our alternative test sites, or depending upon their insurance status, they may be referred to other venues that would make provisions for that testing. We have been doing this to some degree over the last week, where we have partnered with, well, not really partnered, but we have been referring individuals to one of the clinics that programs that participates in our safety net clinic program, Montgomery Cares, who has been doing some of that screening themselves, and they have been able to either have them come into their clinic to receive follow-up services and a test, or have been directing them to a network of other support services. And the expectation is that folks will be able to utilize those different sites to get the test, and in some cases, and when they do need follow-up care, we've been working to connect them to a host of other clinics dependent upon their insurance status.
And the hotels?
And the hotel piece, yes. So HH Health and Human Services has been working to stand that up. We recognize that we actually think that, to your point where you mentioned the congregate living settings where you've got a high number of people living in a small amount of space, we think that has contributed to more cases in this county, because we've got a lot of large buildings where a lot of people live in, and then even within individual units, you've got potentially a lot of folks living in a small space where it is difficult to isolate in place. And so recognizing that, the team has been working to build a system to be able to meet the needs for individuals where that is difficult to do. And so they're working on the criteria and working on the networks to be able to provide a referral source for people to go to.
Okay. Okay, up next is Rebecca with the Washington Post with a question for both. Oh, hold on, Rebecca.
Sorry. Two
Yeah.
questions, one for Dr. Gayles and one for the county executive. The first one for Dr. Gayles is, social distancing measures have been in place for about 2 months now, and the stay-at-home order has been in place for a month. So we have a lot of questions from residents about where are these new infections in Montgomery County still coming from? Where are these new deaths still coming from? And then related to that, is there evidence at this point that the extreme measures, social distancing measures, have been effective in flattening the curve?
So let me answer the second part very clearly. So the social distancing, sheltering in place, face coverings, all of those have been tremendously impactful in terms of keeping the curve down. I wish I could, and we can maybe get you some examples of the projections and models that we've seen that have shown what the numbers would look like if those measures were in place. So yes, to the folks at home, the measures we put in have been very effective in terms of flattening the curve compared to where it could be. Now we recognize though that again, as we test more folks, and it's not solely because we're testing more people to explain new cases, but some of the things that could explain it. One is we're testing more people. So yes, by virtue of testing more, we're going to see more cases. Within that, it's important to tease out, though, that we've expanded the criteria as well. So before and historically up to this point, we've only really been testing individuals who are symptomatic. And we recognize that science and data has shown us over time, and this is the decision that drove wearing face coverings in public and in settings, because we learned that individuals who are asymptomatic can still transmit the virus to other folks. And so recognizing that we don't know necessarily what that true percentage is, some estimates have said it's upwards of 20 to 25% of COVID positive patients are asymptomatic. And so as a result, our efforts to test more people isn't just to test everybody who's got symptoms, but to really start penetrating those who don't have, identifying those who are asymptomatic. Because if we can get those folks identified early on or fairly early, we can get them isolated and remove them from, and identify their contacts and remove them from potentially transmitting to others unknowingly because they don't have any symptoms. Now, the second part of that is, we also know, to Alberto's question, is what's different about our community. There are a couple factors that are different about our community than some of the others. One is we do have a high amount of folks who live in very densely populated units in areas of the county where there is a higher amount of congregate living in comparison to some of our other jurisdictions. You can think about it in the sense of if there are two families sharing one household where there's potentially only one bathroom, or even, two bathrooms, but you've got 10 to 12 people living in one place. If one person tests positive and they come home, they aren't symptomatic yet, and they've been around their families for a few days, then they develop symptoms and they get tested. You can imagine at that point how all of the family has been potentially exposed. And we have seen, particularly with our ready responders now being able to go in and test folks in their home settings, we've seen that happen where we've gone in and there've been 10 residents to a small place and we've tested 4 or 5 people positive. And so that's a reality here. Another thing that we've talked about a little bit about before, to the county executive's earlier point about the boundaries within the jurisdictions, we've got a lot of people who still have to go to work. And so I know that, a lot of folks are teleworking and we celebrate our ability to leverage that technology, but we still have a lot of people who reside in Montgomery County who are essential employees here in our jurisdiction, as well as essential employees providing services in the district in Northern Virginia and other parts of Maryland. And so we've got a lot of people who are still having to go out and work and are potentially being exposed. And so I think there are a lot of factors that are driving it. There's not one that I can point to. And to be perfectly honest, as best as I can tell you, when looking at the data, we don't have evidence of any one particular spot that is an outbreak, so to speak, that we can identify and shut down. So hopefully that addressed your question.
And Rebecca, are you all set? Did you have a question for the county exec?
Yeah, sorry, one more question for the county exec. So we've seen and heard from businesses in Northern Virginia who are, pushing back on the delayed reopening. Have you heard from businesses in Montgomery County who are frustrated and would like to reopen on Governor Hogan's timeline?
Well, nobody knows what Governor Hogan's timeline is right now for reopening.
Sure.
That's totally speculative. So I don't know whether that's a good idea or not, because I don't know what it is. But I will say, I mean, I've heard from people who'd like to reopen. I got to say that my job is to keep people safe. And as much as somebody would like to have income, and we'd all like everybody to have incomes and people to be employed again, if we do that prematurely, Dr. Fauci was pretty clear about that yesterday. We do this prematurely, this is just coming back. And then we're going to shut down again. And then this is going to prolong the period before we ever get to return to normal. And so I understand the frustration, but sometimes you got to take the long view. And what looks like it, would be really convenient and helpful today could wind up sabotaging everything you've tried to do to get to a place where we really could reopen, where we really had confidence that the numbers of cases in our county and in the surrounding counties were at levels that were manageable, where we had enough testing available that we were doing all the contact tracing with a test kit, so that we knew we hit everybody who had been in contact with somebody. When we have all that and we see numbers that start to make sense, then we'll do what we can do to let up on things. But to let up because somebody's frustrated, I mean, I'm frustrated too. I don't think there's anybody on this call who is particularly happy about what's happened to our lives and the things we're not able to do anymore. I understand the pain that people have. Most of us are lucky enough to still be working, but it must be terrible for the people who are sitting out there on unemployment. All that said, I would rather be on unemployment and safe than be employed and have COVID and then wind up unemployed and in a bed someplace. I mean, we are making the best decisions for the health of the people of our jurisdictions. And I think that's what I hear from most residents. That's what they want us to do, and that's what I'm going to keep doing.
Thank you, sir. Jordan Lindsay is up next with a question for you both about the customer service line regarding testing. Jordan?
Yes, I think that Dr. Gayles also already touched on that for the most part. I just did want to know, why did you see a need for this testing hotline? Can you maybe elaborate on the need for a specific testing hotline like that?
Sure, that's an excellent question, Jordan. So we realized that in our efforts to expand testing, a lot of testing was related to having a doctor, and then a lot of testing, even in our alternative sites, we created spaces that, you had to have a car, even though we were trying to make them geographically open. The reality is many people were still locked out of the system because they did not have access to a primary care provider. We heard lots of stories where individuals who didn't have insurance or have a primary care provider say, I showed up to an urgent care, the test was free, but I was being charged a couple $100 visit fee that they didn't have the resources to meet. And so even in our efforts of working through our safety net clinics to provide referrals to our alternative test sites, we recognize that having access to a provider, because you had to have a referral, you still have to have a referral, was a major obstacle. And so what we wanted to do is we figured, how could we remove that obstacle? How could we remove that barrier? And so this is just one piece of, again, I've used the term before, our testing buffet, that we are creating multiple entry points for people to be able to utilize to get access to testing, regardless of their insurance status and regardless of their relationship with a primary care provider.
And I want to say we're trying to get that message out to people because people have been frustrated by the cost of the urgent care centers. If they don't get tested, that just complicates our problems. So we need people to get tested. I have urged people who work in the community to send people to the clinics, which they know and have familiarity with, and to contact them. They'll be able to contact the hotline. We want to make sure that we can get people to bypass the urgent care centers, because if they hear that what the bills are, I mean, I've been told by people that they could not handle it and they walked away. We can't afford to have anybody who might be sick walking away from a test because they can't afford the medical care. notes to people about what needs to happen with the medical system in the long run. But right now, we need to make sure that people can get access and get referrals, and cost should not be an issue in the issue of public health.
Okay. Miriam with Montgomery Community Media is up next with a question about a drug.
Hi. So at Governor Hogan's press conference last week, he said that Maryland got 1,600 doses of remdesivir and that they'd be going to Montgomery County and Prince George's. So can you give an update on that? Did we get it? Is it being administered? How is this going to work?
Well, I can provide an update on that. So per conversation with the State Department of Health on Monday, we were notified that the drugs are being delivered directly to the hospitals. They aren't coming to the health department to divvy up to the hospitals. And that process, from my understanding, started early this week. And so the hospitals, if it hasn't started, that is in the works. So the drugs will be administered directly to the hospitals, based upon, the need. And for those at home, what it's referenced to as remdesivir is an antiretroviral drug that has been used or studied in the past to see its efficacy against SARS. That's a virus that we're familiar with from the past. And the initial studies showed that, particularly for individuals who are sickest patients, the most critically ill, that it cut the duration of the symptoms and disease by 4 to 5 days, from a 2-week period to about a 10 to 11 day period. And the thought is that if you can initiate that therapy earlier on, it can keep people from developing more severe symptoms and needing a higher level of care.
Okay. Thank you, Dr. Gayles. Kevin Lewis from ABC7 News is up next with 2 questions for the county executive. Kevin?
Hey, guys. So County Executive, I understand the council today was going to discuss a slight reorganization, I guess you could call it, of the Public Information Office to better communicate with members of the Spanish-speaking community. Do you mind telling me a bit about what that will entail and how you think that will help, particularly during COVID, but even moving forward from here?
It's a good question. We had a vacancy because we had frozen hiring in the county as a result of the COVID, and so we did not fill a position. We assembled, in working with the council, a multilingual team that is out communicating with the community, producing both video, promos on radio, and doing events. So it's not clear to me how this fits with everything else. But I guess if they want to promote what they're doing, that's what they want to do. We were a little taken aback that they created it by basically taking a position away from the county government and parking it over there. I felt like if they felt strongly that it needed an exclusive Spanish speaking outreach, they could have had that conversation. But it is what it is.
And then, so you're supportive, I guess, is what I'm hearing, of the idea, but wish they had gone about the actual allocation of resources differently?
Well, I wish I understood what more they wanted us to do with what we had set up at their request and with their cooperation. Because, this position is not going to go away after COVID goes away. It's a permanent transfer. It's not like lend us a person. This is give us a position, and it'll be there when this is gone. Okay. I think, personally, I thought that they're pretty well staffed on the public relations side.
My other question on a separate topic was, I was watching the county council meeting this morning, and they were talking about union contracts, and there was a pretty heated conversation. Councilmember Hucker, for example, said that morale among the rank and file is at an all-time low in the county, and that this is a time to give raises. Councilmember Craig Rice seemed to almost begin to cry, talking about how his wife is out of work, and this is absolutely the last time that county employees should be getting raises. Which side do you side with, and why?
Well, the contract, the unions had given up all the inflation adjustments. And so they were out of the contract. And what was left in there was the step system in the county. And our staff looked at what the cost of that was and determined that there is no real cost to the steps, because all that happens is, just think of it as an elevator. So somebody, is on the first step and somebody on the second step. People enter at the bottom and people go off at the top. And so when staff did an analysis, they found that if you take the COLAs out of the annual increases that people got, the actual wage base stayed the same. It didn't change the wage base. And so if you imagine, I know that he had numbers for 19 and 20, that if you took the 19 number and looked at the average wage on February of 2019 and looked at the average wage on February of 2020, the difference was wholly attributable to the COLA, because the COLA goes to everything, and the COLA makes everybody's pay more expensive. But if it's just the steps, somebody on step 1 moves to step 2, somebody on step 2 moves to step 3, somebody comes into the system at step 1, somebody retires at the other end. So in terms of a desire for a same services budget, just using the steps, you pretty much get a same services budget. And the unions gave up the other part of it, which was what you negotiate in COLAs. Normally, you don't even negotiate the steps, because the steps are part of the contract that an employee signs. When you, just like if you're a government worker, you're on a government scale. The government has steps. And if you're a government employee, you know what step or grade you're on, and you move through that progression. And our employees have a similar system. You move through a progression over time, which is supposed to recognize, that you have more value the longer you've been here and the more familiar you are with work, and I don't have to train new people. It's something that has been, largely not considered, except when the county had a period of time when they actually needed to, during the last recession. We are going to provide and have identified enough savings that we don't need this number to achieve a particular goal. I mean, the council has not set, like, we need to see savings of X amount of dollars. And so why they would say, I need this number to be 0, when it actually is 0, rather than I need the executive to bring back savings that reach this goal, is a little baffling to me. But we are going to present them with a broader picture of what we anticipate for savings for the coming year. Obviously, there's a bunch of stuff that's not going to happen this summer. And there are services that are going to be curtailed because of the need for social distancing or physical distancing. I don't think anybody anticipates the rapid reopening of venues. And we also have a large number of positions that are vacant and been frozen. And we were going to continue the freeze at least into the first quarter of the year, because, we're just putting ourselves back together. We don't know what services will fully come back. There's no point in hiring people and then training them and then sending them home so that they're getting paid when they're not able to work. So we think we can meet everybody's goal of saving the money that we need to save, and that the steps would not have harmed that goal one bit.
And our final question for the day is from Rebecca Tan. It's a follow-up for the county executive.
I'm good, actually. Thank you.
All set? Okay. Well, we appreciate everyone taking the time this Wednesday afternoon. We will see you back here again in a week, unless something prompts us to hold something sooner. Take care.
Thank you all.